Now, let me introduce our speaker for today. Mr. Chua is a pharmacist with over 10 years of experience in hospital, community pharmacy, and compounding settings. He was a clinical pharmacist under the infectious disease team in Hospital Raja Permaisuri Zainab II, Kelantan, in charge of medication therapy, adherence clinic, and retroviral disease. He has been working as a community pharmacist since 2012 and have held positions which includes chief pharmacist of a leading chain pharmacy in Malaysia. Mr. Chua is a trained quit smoking pharmacist, sleep pharmacist, and provisionally registered pharmacist trainer. He is currently the COO of Bespoke Health, which focuses on restorative and regenerative medicines. Mr. Chua believes that everyone is unique and one size does not fit all. He therefore works hand in hand with specialists, general practitioners, psychologists, and allied healthcare professionals, allowing for a more holistic health improvement among patients. So we would like to thank Mr. Chua for spending your time with us on a Saturday and providing us with this very valuable session that we are about to experience. Mr. Chua, on to you.
Hi everyone, thank you Ms. Kitara, thank you Ms. Pravita. So hi everyone, I'm Chua, I'm a pharmacist from Bespoke Health. So today we have like a sharing session on how to sleep better. Okay, so after this session and after my presentation, I'm sure you can sleep better tonight, but please don't fall asleep during this session. Okay, so I want this session to be an interactive session. So I will be asking some questions and you all can reply using this chat, okay? So we also will have some giveaway and yeah, we will announce the winner later. So everyone can see the slide, okay?
Yes.
Okay. Okay, so first of all, let's watch this video, a little bit introduction about Bespoke Health.
Bespoke Health is a healthcare company focused on restorative and regenerative medicine. We use the latest technology to prepare bespoke medications using high-quality ingredients. Our belief is that everyone is unique and requires different dosages according to age, gender, medical history, and physiology. Almost 1 in 4 Malaysians suffer from insomnia. Do not worry if you're one of them. Bespoke Health has got your back. Our sleep medicine consultant provides personalized management and treatment for such conditions. We work closely with specialists and a group of doctors to provide you a holistic approach in the management of your sleep. Our mission is to help you sleep like a baby. Bespoke Health offers a weight loss program which is structured and closely monitored by our consultants, so that you can reach your desired weight in a safe and healthy manner. Most importantly, getting rid of the visceral fats. Weight loss contributes to better image, better health, and prevents lifestyle diseases. There is no one-size-fits-all when it comes to health, and that is why we are here for you. Talk to us now to have your personal customized health management plan. You will have no regrets.
Okay, so Bespoke Health is actually like we practice holistic approach. So we believe everyone is unique and we will have a proper consultation with our clients or patient So normally the consultation will spend like around maybe 30 minutes to 1 hour, depending on health condition. Then after that, we will customize a personalized management plan for you all. So everyone is unique, everyone has their own management plan. Okay, so first question, what time did you sleep last night? Just tell me what time did you sleep last night? You all can reply at the chat room here. 9 o'clock, 10 o'clock, or 2 a.m. You all know how to use the chat? Okay, 12 midnight, 11, that's very good. 10 a.m. is even better. 10 p.m. is even better. 9 p.m. Okay. 12 midnight. Okay. So it's very good that generally everyone sleep before 12. Okay. Then the next question. How many hours do you sleep? On average, how many hours do you sleep? What, 6 hours? 5 hours, okay. 6 to 7, I can see average is 5 to 7 hours. Okay, 7 hours. Okay, so I roughly know. Okay, and the next question. Do you have rested sleep? What do you mean by do you have rested sleep? Meaning when you wake up, do you feel refreshed when you wake up in the morning? You know, because I have a lot of clients, they told me even though they sleep like 7 or 8 hours, they still feel like very sleepy or tired in the morning. So do you have rested sleep or do you feel refreshed upon waking up? Okay, good. There are 2 years, yes, sometimes tired. Okay. Okay, do you have interrupted sleep? Like waking up to go to the toilet? I noticed a lot of people, they will wake up like, some people at least 2 to 3 times to go to the toilet. Nope, nope, okay. No from Celine and Ivy. What about the rest? Do you all wake up to go to the toilet? No, from Mahira as well. Yes, from Haikal. Okay. So there are some yes, there are some no, sometimes from Ko. Okay. Do you have active brain at night? You know, now a lot of people, most of the customer, I can say almost 100% of my customer told me, you know, before they sleep, they will think about their children, think about what to do the next day, think about work, you know. Do you have active brain at night? Because if you have active brain at night, definitely it will affect your sleep. You know, you will suddenly recall, I forgot to do this. And you need to go, you know, keep thinking about it and cannot fall asleep. Okay? Okay, so nowadays a lot of people have this coronasomnia. It's not only insomnia, but coronasomnia. What is coronasomnia? So coronasomnia means characterized by an increase in sleep problems during this pandemic. Okay, because yeah, you can see previously our COVID number was going down, went down to like 3,000, and recently up to 5,000 again. Okay, so during this pandemic, a lot of people have this anxiety, depression, or they feel stressed, they are worried to go here and there because they are getting infected by this COVID. Okay? Okay, so this is, if you have insomnia or coronasomnia, what have you tried? Because when we did our consultation with our customer, there are some customer told me that, oh, I went to psychiatrist and they give me antidepressant pill or they give me like a sleeping pill. Or some, they go to the pharmacy to get those antihistamine to make themselves drowsy, and the next day they have hangover. So all these like antihistamine is like for short term, yeah, you can sleep for one night, but the next day you feel even more tired, you know, because of the hangover effect. Sleeping pill, yeah, no, sleeping pill, it will cause, in long run, it will cause addiction. Okay, so we are trying to avoid sleeping pills as well. So today we will discuss how to sleep better, okay, without using antihistamine and the sleeping pill. So how sleep works and why it's important. So there are two types of sleep. We call it REM, rapid eye movement, and non-REM. Okay, so just a brief introduction. What is this REM, non-REM? So non-REM, we call it sleep, includes what is commonly known as deep sleep or slow wave sleep. Okay, so REM happens about 1 to 1.5 hours after we fall asleep. Okay, so you can see there are like stage 1, stage 2, stage 3, stage 4, stage 5. When you know, for the first 5 to 10 minutes, you feel a little bit drowsy. Then you have light sleep for 20 minutes. Okay, then moderate sleep for 10 to 20 minutes. Then you have deep sleep. Then you have REM sleep. Okay, then you will repeat and repeat again. So your ability to function and feel well while you are awake depends on whether you are getting enough total sleep. Yeah, so by right, we need to have at least 7 to 8 hours of sleep. But like from just now, you can see some people, they only sleep for 5 hours. Some people, they only sleep for 6 hours. So that's not enough. Okay, but it's good that most of you sleep before 12, because I have some customer, they ask me, can I sleep from 2 a.m. to maybe 10 a.m. but I have 8 hours of sleep. Is that good? No. Okay, because we want everyone to sleep before 12. Okay, so if you sleep like maybe 3 a.m. to 11 a.m., you got 8 or 9 hours of sleep, that's not a good sleep. Okay, so this one just I asked, do you feel refreshed in the morning? Because there are some people, they feel tired waking up. Okay, so sleep deficiency, it will cause what? You will feel tired in the morning, you will feel less alert, then it will interfere with your work, your school, your driving, your social functioning, you like blah, blah, don't know how to social with people. Then some people, they have mood swing. That's why some people, they get angry very easily, cranky, feel frustrated. Some, they will have this worry. Okay, so this article shows that 9 out of 10 Malaysians are suffering from one or more sleeping problems. And this one you can see, and it can lead to mood swing. Okay. So among the elderly, it's very common there will be a decrease in the deep sleep stage and increase in the period of wakefulness during the night, meaning you all tend to wake up during the night. But it's common for older adults to experience changes in quality and duration of sleep. It's common, but we will help you to sleep better. Okay, so why does this happen? It's because our body changes when we are aging, and our hormone also changes when we are aging. So changes occur due to changes in our body internal clock. So there are hormonal changes such as melatonin or cortisol. So melatonin, sometimes we call it like vampire hormone. Why we call it vampire hormone? Because our brain will only produce this melatonin in the dark. Okay, it will produce during the daytime. Okay, and cortisol is one of the stress hormone. When our cortisol is too high, definitely it will affect our sleep because we are in stress. Our body is very stressed, so it will affect our sleep. So these hormonal changes, both melatonin and this cortisol, or sometimes in female, then it will be linked to the progesterone, will affect your sleep. Okay, the second one, body secrete less melatonin, which is normally produced in response to darkness. Like I mentioned just now, we call it like vampire hormone because it will only produce when there is darkness. Okay, so how much sleep do you need? Because sometimes I talk to some client, they'll say, I'm so old already, 5 hours enough already, I cannot sleep. You know, some people think when we are aging, then we need lesser sleep. But that's not the case. Okay, let's see. So this is the sleep guideline. So for 18 to 64 years old, what you need is 7 to 9 hours of sleep. And for those above 65 years old, you need 7 to 8 hours of sleep. So those who only sleep for like 5 hours or 6 hours, that's not enough. Okay, you need at least 7 to 8 hours of sleep. Does taking melatonin help? Okay, yeah. Later we'll answer about this. Melatonin is one of the hormones, so it will help to correct the sleep circadian. Because a lot of people, like last time when I worked in a pharmacy, some customer will come to me like, hey, I cannot sleep, I want to buy melatonin. No, they are like expecting I take 1 pill of melatonin that I can sleep directly. No, melatonin you need to take for maybe 1 week or 2 weeks, or some people they need to take over a few months, because it is not a sleeping pill. Melatonin is not a sleeping pill, but it helps to correct our sleep circadian. Okay, so it helps when we are taking melatonin. So maybe after a week or after 2 weeks or after some time, when our sleep circadian is corrected, then we can sleep better. Okay. What is the gram of melatonin? There are different grams. So normally how we recommend to our customer is we need to go to a proper consultation, then only we know what strength to give to the customer. You cannot take like, you know, it's not like everyone need like, it's just like antihypertensive. Some people might need only 5 mg, some people need 10 mg, some people need 40 mg, some people need 80 mg. Okay, so there's no fixed dose. Everyone is different. Okay. Okay, why is sleep important? Because it helps to regulate the release of hormone that control appetite, your metabolism, your growth and healing. That's why you see baby, we always ask baby to sleep better, sleep more, because it will help them to grow better. Okay, it boosts the brain function, concentration, focus. So if you don't have enough sleep, definitely the next day we cannot focus on our work, then you're like very blur. Reduce the risk of heart disease and stroke. Help for the weight management. So if you don't have enough sleep, you might gain weight. So a lot of people, especially those obese people, most of them, they have sleep problem. So if you sleep well, you can improve your immune system as well. Okay, then you can lower the risk of chronic health conditions such as diabetes, high blood pressure, and also lower the risk of depression. Okay, like we mentioned just now, if you don't have enough sleep, then you will have mood swing. So when you have mood swing, then you have depression. Okay, it's all interrelated. Okay, mental and physical health condition may also interfere with sleep, and the amount of sleep you can get can affect everything from your weight, your metabolism, okay, whether you are thin or you are a bit fatter, to your brain function and your mood. Okay, so this is, so study shows that, see, 2005 studies found that sleeping too little, meaning less than 6 hours, just now there are someone that sleep only 5 hours, is associated with increased risk of diabetes. Okay, and also you don't want this to happen or early death. Okay, so studies in 2010 found that sleeping too little at night increases the risk of early death. And this one in 2011, 15 studies found that people who sleep less than 7 hours a night have a far greater risk of stroke and also heart disease. Okay, so starting from tonight, you need to sleep at least 7 to 8 hours. Okay, so now here we come. What's the tips for better sleep? So during the daytime, now we always encourage our customer to go exercise at least 3 times a week. So each session must be 30 minutes. So there are some people that say, I'm so old already, I got knee pain, I cannot exercise. you can go to your nearby taman. You know, exercise not necessary. You need to run. You can just like jog, or you can just walking. Choose those exercise that suit you. Okay, not necessarily to go to gym and weightlifting, all this. But do not exercise 3 hours before you sleep. Okay, because if you exercise too near to your bedtime, your brain will get very active. Then it will affect your sleep. Okay. Then increase the exposure to sunlight or bright light during the day. This can help to maintain your body's circadian rhythm, which affect your sleep-wake cycle. So we always ask our customer, do you expose to sunlight? No, especially Malaysian, a lot of people, you know, they are scared of getting like tan skin, so they apply sunblock. Some people like wear long sleeve, so wear hat or wear cap, you know, just avoid the sun. But this sun, actually, they have sun. We can get vitamin D from sun. Okay, vitamin D is very important because it will help to improve our immune system, and also it will help to maintain this body circadian rhythm. Okay, so we need to get enough sunlight in the morning or enough vitamin D in the morning. Then we need to, at night, our brain will produce enough melatonin. Then only it will balance. So our brain will know, okay, now I got sunlight. I need to be very alert. Okay, then at night, okay, it's time for me to produce the melatonin. It's time for me to relax my muscle and sleep. So during the day, avoid nap. Okay, some people say, you cannot lah, I need to rest. Yeah, you can have power nap, but not too long. So the power nap is normally like 15 to 20 minutes. And if you are afraid that you sleep too long, you can always, you know, use your smartphone to set alarm. Next, try to wake up at the same time each day. So if you can also set alarm, so every day I want to wake up at 6 a.m. Then so set your alarm 6 a.m. Every day we wake up at the same time. Not like today 6 a.m., then tomorrow 10 a.m., then the next day 12 noon. So actually you need to train your body to wake up at the same time every day. Okay. Are you reliant on caffeine to get you going throughout the day? So I'm sure there are a lot of like coffee lover or tea lover here, you know. There are some people that tell me, hey, every day I need to drink coffee. If not, you know, I hate it. I feel very tired. Yes, you can have coffee, but, okay, but we always tell our customer, you can take coffee in the morning, but not after 2 p.m. Okay, your last cup of coffee must be before 2 p.m. because all these like caffeinated drinks, like including the tea or the coffee, it will affect our sleep. Later, the next slide I will explain. Okay, not only caffeine, so alcohol or nicotine, including both cigarettes and vape, it will affect our sleep. Okay, so one study found out that caffeine can delay the timing of our body clock. Then it will affect our sleep. Okay, then the half-life. Okay, you see, this effect can be stronger or take longer time to process caffeine among elderly. So the half-life is 3 to 5 hours. The half-life meaning, let's say we take like, let's say just for example, we take 10 mg of this medicine. So after 3 hours, it will reduce to 5 mg. Okay, so when we are aging, our metabolism will be slower. So it will take longer time for our body to eliminate those caffeine out of the body. Okay, so consume it earlier in the afternoon before 2 p.m. Okay, before bed, what do we need to do before bed? Switch off all the electronic and gadget at least 30 minutes before bedtime. Okay, because all these blue light emitted from your iPhone light, your TV light, can stimulate our brain and make it harder to fall asleep, because all this blue light will, you know, stimulate our brain. Then we feel like, oh, now it's very active. Because now at night, a lot of people like watch maybe Korean drama, or some people they are like Netflix, YouTube. Some people, you know, scroll the Facebook or Instagram. Will make you more and more active. You want to know more. I want to watch the next episode, or can finish one season one night. Okay, so we need to control ourselves. Switch off all these gadgets at least 30 minutes before the bedtime, because all this blue light emitted by the gadget also can inhibit the production of melatonin. Okay, so remember, melatonin is the hormone that helps to correct the sleep circadian. Okay, and what else you can do before bed? Listening to soothing music. Some people, they will meditate or read a book or drink warm milk, and avoid eating spicy food. Okay, like tom yum, all this you can take maybe for your breakfast or for your lunch, but try to avoid at night, because all these like will trigger your stomach and will affect your sleep. Okay, so besides spicy food, there are other food, we call it cruciferous veggie. So what is cruciferous? Cruciferous vegetable are like cauliflower, broccoli, bok choy, cabbage, and Brussels sprout. Okay, so all these cruciferous vegetables are very good, but we don't take cruciferous vegetable at night. Okay, you can take it during your lunch, during your breakfast, but try not to take it at night, because all these cruciferous veggie will affect your sleep. Okay, because it's harder to digest. When our stomach is very active to digest what you makan, then you cannot sleep well. So remember, all these cruciferous veggie, they are very good, but try to take it in the morning or during the lunchtime, but avoid taking during dinner time. Okay, so what do you do when you are in bed? Close your eyes, relax your muscle, and focus on steady breathing. You know, some people, they will count the sheet 1, 2. Okay, and pillows. Make sure you choose the right pillow for yourself and also the right mattress. Some people, they like a softer pillow. Some people, they like harder pillow. Just, there's no right or wrong, but choose the one that you feel comfortable. Okay? And use your bedroom only for sleeping. If you cannot sleep, please don't stay in your bedroom and scroll your phone, watch video, watch YouTube, or scroll Facebook, Instagram. Get out of your bedroom and go to your living room. Okay, train your brain that bedroom is only for sleeping. So you can go to the living room to read a book or listen to music until you feel sleepy. Then only you go back to your bedroom. Okay, sleep apnea. There are a lot of people have this. We call it obstructive sleep apnea. So how we know whether we have obstructive sleep apnea? You can see these few questions. Do you snore loudly? Normally, your partner will know lah, you know, because you are sleeping, you are the one snoring, you will know. And your partner will notice that you snore very loud. Okay. Do you often feel tired, fatigued, or sleepy during daytime? Has anyone observed you stop breathing? Because sleep apnea is a condition that there's one of the muscle here actually collapse and block the airway passager. So sometimes we'll stop breathing, so that we need to snore very loud to open the airway passager. Or do you have, or are you being treated with high blood pressure? Your BMI, is it more than 28? Or are you like more than 50 years old? Or your neck circumference, is it more than 38? Okay, so if you have 4 years, maybe meaning you are high risk to have this obstructive sleep apnea. Okay. So just now we talk about stress, we talk about active brain. So a lot of people have stress. I'm sure all of us are stressed. Some people, they are stressed with financial. Some people, they are stressed with their health. You know, like, why I already control my diet, why my blood sugar is still so high, you know. And also some people, they are worried with this COVID, because like you see the cases is getting higher and higher. Some people, they are very stressed of this flood. You can see, okay, yesterday suddenly rained so heavily, also scared of flood come again. Okay, there are some people, they are worried about their children. When's my boy getting married? When's my girl want to get pregnant? You know, a lot of people every day also we have something to think of. Or now CNY is coming. Do I do I need, did I give hamper to this fella, you know, or do I prepare enough food? And this is what happened just now, my condo. Okay, you see, never ending mental stress for me nowadays. Beli barang also never know if lift are functioning. So if our condo lift is not functioning, we also stress. There are a lot of stress, not limited to this financial or health. Even lift function, not functioning also we feel very stressed. Okay, so depression and mood. Depression and other mood disorder can impair our sleep, causing restless and insomnia. And according to WHO, there are more than 263 million people across the ages are suffering from depression. Let me see. Certificate. Okay. Okay, so you can see the mental health and stress chart here. So everyone is very stressed. You can see more than 66 years old. Very poor quality of sleep. And the highest will be those 26 to 30 years old. Okay. So how does sleep change during menopause or andropause? So when we are aging, definitely it's very common that we will go through menopause for women and andropause for men. It's normal. Everyone will go through this stage. So don't be shy. So if you have all these problems, always go to your healthcare provider, or you can come to us. We can give you a proper consultation. Okay. Going through menopause or andropause and unable to sleep, don't worry, because you are not alone. So everyone will go through this stage. Don't worry. Okay. So menopause is a stage which women life when their ovaries stop producing the female hormone. So after we got menopause, then definitely our estrogen, our progesterone will go lower. It's very normal. So when we, during this stage, some people, they will have mood swings, some people, they have hot flashes, so it will affect their sleep. It is normal. So how can we help to cope with them? Okay, so all these have hot flash, night sweats, or some people have vaginal dryness, insomnia, weight gain, is very normal. Okay, so all these also can help. And for guys, low testosterone, after the andropause, it will contribute to the sleep problem. Okay, so this testosterone, the male hormone, play an important role in regulating our sleep pattern as well. So how do we help? So the most effective way to relieve the menopause or andropause symptoms is with, we call it bioidentical hormone replacement therapy. Okay, a lot of people when they heard of this hormone therapy, they are very scared that, hey, will I get cancer, you know, because of this synthetic. So synthetic hormone and bioidentical hormone replacement therapy, they are two different things. Okay, how is it different? Bioidentical hormones is identical to the hormone produced by the body. Okay, and it's produced from natural plant substances such as yam or soy, and it mimic the effect of our endogenous hormone, meaning our body hormone. And it's a customized dose for individual, and it can promote the good health. So it's different from all these synthetic hormone. Okay. So I will share some key studies that how we have helped our customer. So we have this customer which is 73 years old. So she has insomnia. She only sleeps at 6 a.m. You could, no joke, but she only sleeps 6 a.m. She always got this active brain, think about this, think about that. She tried everything in the market, go online to buy melatonin lah, buy this and that lah, you know. But and so tried antihistamine, ended up feeling drowsy. So she came to us and we have a proper sleep consultation. Then after that, we gave her some vitamins, or because we found that she is lack of certain nutrient. And now she's very happy. She can sleep very well. Okay. And also we got this 54 years old lady, okay, already in the menopause stage. She's the head of department. So she's very stressed. because head of department is stressed about work, then stressed about family. So she told me she only sleep 2 to 3 hours every night. And also she wake up 3 to 4 times to go to the toilet. And after that, very hard to fall back to sleep. So the next day she feel very tired, you know, then she got mood swing now, always scold her konjo. Okay, so she also come to us to ask for help. And now you can see she can sleep from 11:30 to 6:30, and now she's happy. You can see, yeah. Now I feel very alert and full power, can wash my car and car wash. Okay, and also we actually dose her with some BHRT, the Bioidentical hormone therapy. So what she said to us is, last time my leg feel very dry and skin peeling, but now I found that it's smoother and I didn't even apply any cream. Okay, and so she introduced her friends to us. And also we have like breast cancer patient, we have sleep problem, very stressed, very depressed, and even have suicidal thought, and now she can sleep very well. And we also have another one like staying alone because her daughter is staying in Korea. So she only sleep like 2 a.m. to 5 a.m. So I'm like helping this daughter to take care of the mother. I told the mother that, hey, cannot, you need to sleep before 12. So we actually monitor her almost every day. And now after 3 months, she told me that she is very energetic and very happy. Okay, so the next one, gut health. Gut health is very important because our gut is like our second brain. Okay, so intestinal health has a close connection with healthy brain function. So if you have leaky gut, you have a poorer body immune system, then our cortisol level, meaning our stress hormone, will go very high. So if you are very stressed, then our gut, you know, some people, when they are nervous, they always go to the toilet. And we notice a lot of our customer, they have this bloating problem. So bloating, a lot of people with bloating problem, they have sleep problem. These two are always interrelated. Okay, the increase of stress hormone, meaning the cortisol throughout the body, can make it more difficult to fall asleep. Okay, so we need to take more probiotics or prebiotic food. So the probiotics, you can either take the supplement or you can consume certain food like kimchi, yogurt, miso, tempeh. All these are the source of probiotics. And asparagus, oats, banana, garlic, artichoke are the source of prebiotics. Okay, so that's all for my presentation today. So I want to wish everyone Gong Xi Fa Chai. So hope this year is a better year, you have better sleep and better health. Okay, so we provide a lot of services such as adult sleep consultation, we have medicine use review, we have hormone and wellness consultation, we have health screening, vaccination, etc. Okay, remember this, this is one of the quiz later. So user can customize hamper to our customers. Okay, so now's the quiz. Miss Kitara or Miss Pravita, I need your help to see who is the fastest to answer.
Okay.
So the first question, what is the recommended sleeping hour for those aged more than 65 years old? 5 hours, 7 hours? Okay, you can see, so you help me to capture who is the first one that replied. So it's 7 hours, okay? The answer is 7 hours. So the next question, are you allowed to exercise close to bedtime? Yes, no, or I don't know. Are you allowed to exercise close to your bedtime? Okay. Okay, sorry. Okay, then so we don't exercise when close to our bedtime. We can exercise in the morning or in the afternoon. So does gut health affect mental health? Yes. Miss Kitara, are you able to capture or am I too fast?
I can capture. I mean, I know the name, yeah.
Okay, okay. Okay, so the next question. Yogurt is a source of probiotic. A lot of people answer very fast. Huh? Okay. Okay, name me one of the services provided by Bespoke Health. Just now I showed the slide. Okay, sleep, vaccine, consultation, weight loss. Okay, yeah. Okay, so we'll have 5 winners.
Generator and other accessories lah. Okay, will what might be affect the radiation dose as well as performance. Okay, so it must be certified by QC company. Okay, why?
Who is the one talking? Okay, so no problem. Okay, so we'll be giving up 38 ringgit ang pao for everyone here. Okay, you all can enjoy this 38 ringgit ang pao. Okay, this is our contact. So, any question? Okay, any question you can ask and we will answer.
Feel free to unmute yourself and ask if you have any questions.
Hello, Dr. Chua.
Yeah, hi.
Dr. Chua, can you tell us something about bioidentical hormone treatment?
So, bioidentical hormone. So, bioidentical hormone, it can be in pill form, it can be in cream also. Okay, so like I mentioned just now, one of my customer, but it's a woman. Okay, she's already menopause. Then before we dose someone with this bioidentical hormone, we need to do the blood test first. Why? Because we need to check their hormone. Okay, there's a, you do the blood test, you can test your cholesterol, you can test your renal function, but also we can test our estrogen, progesterone, testosterone. We need to, after we got the result, then we need to calculate the ratio. And also, another one is we need to check whether your tumor marker, like CEA, CA199, etc. Okay, because we want to see whether you have this, whether you are high risk for cancer or not. So if you have high risk for cancer, we cannot dose you on this bioidentical hormone. So how we dose the lady with our progesterone cream is, we will ask them to apply like every 25 days, and their thin skin there, every day like apply different site. So after some time, they can feel the difference because progesterone is a woman hormone. So after you apply already, it will help you to relax, okay? And you feel like you are more woman as well. But for guy, definitely we will go for like testosterone. We won't give you the progesterone cream. Okay?
Thank you.
So, and yeah, we can have nap, but not more than, like just I got one slide to talk about the nap. We can have power nap, but not more than 30 minutes. We actually open, we open Monday to Saturday, but Sunday we are closed. So if you're interested, you can always WhatsApp us, 01925199198, or you can email us. What if I'm unable to sleep continuously for 7 hours, wake up and do something? So, is it okay if I sleep for 4 hours, wake up and do something, then sleep for another 3 hours? Is this considered sufficient sleep? No. So this is called, we call it interrupted sleep. Okay, interrupted sleep meaning it's not a good sleep. A good sleep meaning you can sleep for 7 hours straight. It's not like halfway wake up, do something, you read a book or do your work, then fall asleep again. That's not a good sleep. Okay, so if you can only sleep for 4 hours, then you suddenly wake up to do something, meaning something is wrong. Maybe you are lack of certain nutrients or maybe some you are very stressed, your cortisol is go very high, or certain hormonal imbalance. No problem, you can redeem the sleep consultation. You have a proper consultation with you to find out the problem. No?
Okay, I think Miss Lee Yanhua has her hands,
Raise
the hand up raised. Yeah, the hands raised. Miss Lee Yanhua. Okay, never mind. Actually, Mr. Chua, we have some pre-webinar questions that we got.
Okay.
So, one of it is, should one self-treat one's own inadequate sleep with lorazepam?
No. That lorazepam is sleeping pill.
Mm.
How to self-treat with lorazepam? Where did you get the lorazepam from? You know, lorazepam cannot simply get from pharmacy or cannot simply get from the clinic one, because we call it dangerous drug, and you cannot simply share medicine with anyone. You cannot like, hey, my neighbor is taking this lorazepam, the sleeping pill, so I just take one from him to take lah. Cannot, because everyone might need different dose. Maybe the neighbor that is taking lorazepam got certain health condition. That's why the psychiatrist prescribed him with this lorazepam. But we cannot simply take. We call it dangerous drug.
Okay, thank you, Mr. Chua. So we got,
Hello,
anyone
Mr.
else
Chua?
has any? Yeah.
Mr. Chua? Hello, Mr. Chua.
Hi.
Can we take melatonin?
Yeah, you can take melatonin, but you need to take the right dose. If you are taking 2 liter, then it doesn't work. So, and one of the side effects of this melatonin, if you go too high dose, some people will get nightmare. So you need to take the right dose. And so far in Malaysia, melatonin, you cannot buy melatonin in the pharmacy. You know, melatonin can only sold by like compounding pharmacy. And most of the people, they buy this melatonin online, which is no MAL registered one. It's considered a little bit illegal. It's not registered in Malaysia. Some people buy from iHerb, all this, meaning it's not registered in Malaysia. Malaysia, only the compounding pharmacy can sell melatonin.
Okay, Mr. Chua, we have another question. Some of them have asked for resources for carers regarding sleep hygiene.
Resources for carers?
Yeah, caretakers, caregivers and all. Do they have any resources for them so that they can ensure that the older person is getting enough sleep?
Like what I mentioned just now, all the sleep tips. And if they need more help, they can contact us directly, no problem. Because we also need to know what sleep problem is maybe the elderly is facing, because everyone have different problems. So it's not like something very generic and general.
Okay, thank you, Mr. Chua. We have another one. Can lack of sleep be due to medical reasons?
Yeah. So okay, that's on one of the slides. So if you have sleep deprivation, it will lead to like you have higher risk of getting this diabetes, heart disease, stroke, etc.
All right, that's all from our pre-webinar. Any other question? I think we got one in the chat box. Can CBD treat sleeplessness?
CBD, you mean the cannabidiol, or what do you mean by the CBD? Yeah, if cannabidiol is not legal in Malaysia, Xanax is one of the sleeping pill. It's similar to lorazepam. Okay, so all these sleeping pill in long run, it will cause addiction. I'm working with a shift schedule. Okay, sometimes if I'm on night duty, I'm unable to sleep for the whole night. Only sleep the sufficient sleep. Okay, so Miss June, so you are night shift worker. Okay, so if you are night shift worker, then no choice. So you need to sleep also in the morning for 7 to 8 hours. If 4 to 5 hours, then it's insufficient. You also need at least 7 to 8 hours of sleep. Okay? So if you guys do have any question, can always contact us, can always WhatsApp us or email to us. We will reply accordingly. Okay? And also you can contact us directly, or you have any question, you can get to Miss Kitara and she will get back to us as well.
So thank you so much, Mr. Chua, for joining us today for the very insightful session. And thank you everyone for spending 1 hour with us on a Saturday. So thank you, and please do enjoy the rest of your weekend.
Okay, thank you and kong si fa chai everyone.
Thank you and Happy New Year.
Happy New Year.